everybody in the Digital Health and Care Learning Network for your Learning Week. I'm Katy McNeil, and I am doing this webinar just to introduce you to a programme that the Scottish Government has launched in partnership with others, called Connecting Scotland, which is aiming to get people who are not currently online to be online, particularly those who are currently in the shielding, the high risk and extremely high risk categories. So just to give you a bit of background, obviously we're participating together in this digital learning event, and I suppose COVID-19 and the lockdown has really highlighted those issues of those who don't have access to data or devices. These are some of the figures. While access to the internet has, the gap between the more wealthy and poorer households has narrowed, it is still significant, and we estimate that around 1 in 8 adults in Scotland are currently digitally inactive, meaning that at this time they won't have access to the same services or the same support from their friends and family that they might have if they were able to access the internet. We've done a lot of work in the past in Scottish Government on the benefits of being online, and we're aware that these cover not just your ability to undertake tasks, but also to have the social and well-being aspects. So obviously, in the context of health, NHS Near Me has been significantly increased through this crisis, through the ability of people to access health and care services online. And it also helps people manage their mental health and their mental well-being by being able to connect with others. We've seen that it also helps young people and other students access the educational resources that they need to continue learning. And it can benefit people looking for employment, both in having the skills and confidence in using technology as a key skill, but also in then the ability to find jobs. And it also saves household costs and can help people continue their connection with services such as social security. And so we were facing a challenge with this awareness that being digitally active is really important to people, but that we've all been experiencing lockdown. And so what we want to do with this programme is to find those people who need access to a device, perhaps access to connectivity and skills and confidence to be able to use that device, who are currently in those a clinically high risk or extremely high risk groups. And so we've been working with SCVO and also with various partners across NHS and social care partnerships, local authorities in the third sector, to identify those people and get devices to them. We have funding for up to 9,000 devices, with 7,000 will be going out between now and the end of June. We also have some pilot phases which have already started with Govan Housing, Glasgow Disability Alliance, Children First and Aberlour. And so we're building our learning really quickly as to what matters to people and how they want to use those devices. I'm just going to go over to how the proposed approach is going to work, because obviously it's going to be challenging to get devices to people at a time when we are experiencing lockdown or people are shielding. So in order that we can reach all parts of the country, we're working with each local authority who's been allocated a number of devices, and they will then work together with SCVO and the local third sector and other public services to identify those who are both in those clinical risk groups, also have a low income, and also don't currently have access to a device or connectivity. And alongside that distribution of the devices and connectivity, people will also be matched with a digital champion who will help them get online and help them set up so they can do the basic things that they would want to do, whether that's making sure they have a connection to a local healthcare or social care provider, or whether it's just connecting with friends. I've gone through our target groups and criteria. As I say, these are sort of so it's people who are excluded on low income and are in those particular risk groups for corona virus. And we'll be looking out to reach out to teams or organisation who have existing contact. So at a local level, if you're involved in health and social care and you have a client group who you think would benefit from this, we have contacts in every local authority now. So please do get in touch with me after this if you have a client group who we might be able to help. Just to say, we're rolling this out really quickly. At the moment, we have are starting to identify some local authorities who are going to go first to test our model. These range from Highland and Aberdeenshire to North Lanarkshire and East Ayrshire. And alongside that, we're building up the training and support. So again, if you have members of staff or people in your team who would like to become digital champions, then please also do get in touch with us. We know that this makes a huge difference to people's lives at this time. We're getting feedback from those initial pilots of how people who have felt very isolated are now able, one person recovering from COVID-19 who's been able to connect with her son and actually see her grandchildren on a daily basis rather than feeling isolated alone at home while she recovers. And we want to build this. This, we hope, is the start. We have, as I say, up to 9,000 in this initial phase. But if it's 1 in 8 adults in Scotland who are digitally excluded, clearly we would love to go further. Our colleagues in education just announced last week they have 25,000 laptops, which will be going out to school pupils who are also facing need to ensure that they're able to take part in learning as schools restart after this period of lockdown. And in the future, I mean, our vision is that in the future, everyone in Scotland is confidently online and is able to access the services, the resources and the connections that will help them lead a fulfilling life. So that's it for now, but would be delighted to hear from anyone and to put you in touch at a local level if you can help us reach client groups either in this first phase or in future phases. And we're also really interested in establishing what the different needs are across Scotland in order that we can evidence and build the case to make this programme go further and improve more people's lives. Thank you.